So I'm talking about the difference between Xeomin and Botox. There's another couple toxins we call neurotoxins out there. One's called Juvo, came out in last year, 2 years ago. Another one called Dysport. I don't really use either one of those regularly. So I'm talking about Botox and Xeomin. So Botox first got FDA approved in the 80s. And when it first came out, there was a problem with it where about 1 out of 7 people would become immune to the Botox. Your body would make antibodies to the Botox particle, and eventually it wouldn't work. So they found that was a problem. In about 1996 or 97, they reformulated it to remove a lot of the unnecessary proteins, because there's a little tiny toxin, is what's called 150 kilodaltons, and a big tail of proteins around it, and your body would respond to this protective layer of the Botox by making antibodies to it and eventually render it useless. So in the late 90s, they changed it where only about 1% of people become immune to Botox. And the determinations about whether or not you become immune to Botox is how many units you get and how often you do it. So if you do it for 10 years, you're more likely to if you do it just one time. But that being said, it's fairly uncommon in cosmetic Botox to have a problem with immunity. It's more of a problem in medical Botox. We're using a massive number of units and they need it medically every 6 months for the rest of their life. So if somebody gets immune to Botox, we just have them stop for a few years. Again, not common, but I just want to identify that that does happen with Botox. In 2003, Botox got FDA approved for glabellar wrinkles, in 2013 for crow's feet wrinkles, and 2017 for forehead wrinkles. And even though we've been using it for those areas many years before then, it was called off-label. We're using it without the FDA's approval, which we're allowed to do. This Botox couldn't market it. And in 2010 or 11, Xeomin came out, Xeomin. It's a newer toxin. These are family called neurotoxin, which Botox was the first one commercially available. Xeomin sought to overcome the problem of immunogenicity or antibody formation. So they took the Botox particle, basically the one that you've heard about, and they stripped all the unnecessary proteins off, and this has the pure 150 kilodalton toxins. So it's a much more pure Botox than the original Botox. And I use the word Botox almost generically, just like we talk about Kleenex, we might be actually using a puff or a store brand. So the botulinum toxin is the real word for it. Xeomin was a purer form of this botulinum toxin, so a pure Botox than Botox. And it was designed so that you don't make antibodies to it. And studies have showed that not only do you not make antibodies to it, but if you're already forming some antibodies to brand name Botox, most people will stop making new antibodies or they might regress a little bit. So that's really beneficial for people that are new to Botox, or maybe they're thinking it's not working as well as it did before. So when they came out with it, we knew that it was at least as effective as Botox and you would not make antibodies to it. At least you're not at all likely to make antibodies to it, so you can be using it indefinitely without a problem. Well, in about the 10 years that we've had it available, there's been a lot of other studies comparing it to Xeomin to Botox in different clinical studies, such as wrinkles around the eyes, or even muscle spasm or headaches or sweating. And it appears to be at least as effective as Botox in all settings. Okay, at least as effective. Is it better? Well, that's a good question. How would you determine better? Does it actually work stronger? That's a very hard bar to test. It works at least as good as Botox in the same areas. But it's got a couple advantages over Botox in addition to not having antibodies. Number one, it doesn't spread as far as Botox. So when you inject the Botox brand, it has a certain amount of spread that might target muscles that we weren't really intending to treat. And I really think about this when I'm trying to get the eyes to open up a little bit more. I don't want to weaken the forehead muscles at all, versus I want to completely weaken the muscles that push the eyes down. So that's got an advantage to using Xeomin that doesn't have as much spread. Other areas like the forehead or crow's feet, that would have no advantage or disadvantage. One disadvantage of Xeomin in that setting might be you might need to give a couple more pokes because it doesn't spread as far. How about onset of action? How long does it take for the toxin to work? Well, Botox takes an average of 5.5 days and Xeomin an average of 3 days. So you get 2 days of additional toxin effect with Xeomin over Botox. That's good, and people really like that faster onset. What about overall duration? It lasts longer than Botox, not quite 2 weeks, but close to it, but longer than Botox on the average person. So as a faster onset, a little longer duration, a little bit more precise, so I get more control, and you never make antibodies to it. So that's kind of why it's becoming a fast-growing neurotoxin and taking a lot of market share from the original Botox, which really was an amazing product that we've used for years. I've been very happy with it. But now given the choice, if I have a patient that's new to Botox, I probably would just start him or her off right away on Xeomin because they'll never make any antibodies to it. There's no question if it'll stop working. And even the 1 in 100 risk of antibody formation doesn't sound like much, but that means that we would meet like 2 or 3 people every week that are gonna become immune to it. So that's something that's important to think about. So we have a little bit longer duration, a little bit faster onset, Again, these are not much. It's just a little bit, a little more precision, not much, but no antibody formation. So all these factors make it, in some ways, a preferred toxin. If I had like a total like freedom of which toxin to use, where Xeomin, Botox, Dysport, I may make different decisions, but usually use one product on an individual patient. Like for example, Dysport, which I'm not going to talk about here, everything's different about it. It spreads far. That might be a toxin when you're trying to treat, like say, the masseters, where I want more spread. But otherwise, that's about the only advantage it has. It has other disadvantages. So Dysport is another type of neurotoxin that we don't really routinely store or carry, but we do have it. We also have Juvo, which people call new tox, and I don't really use it routinely. Not good data on it yet. So Xeomin, we're going to see a lot of growth in the Xeomin market because it is pure, a little longer lasting, a little faster onset, a little more precisely, get a little bit more lift with it. So there's the differences. They all work great, no matter what neurotoxin you have. If it's done properly and there's good balance done by an experienced injector, you're gonna have a great result. But there's the subtle differences we might see between one neurotoxin and the other. Thank you.